Good morning, everybody. It's Thursday, the 19th of August, and this is our COVID update. Thanks for tuning in. We're going to be showing this on 7:32, starting at 1 o'clock. We'll have a re-showing of it every hour on the hour throughout the course of the day. So there are three things that I'd like to accomplish today. So we'd like to look at three things. We want to look at the current situation, what's happening in Pinellas County, the state of Florida, also here at Regency Oaks. We're going to talk about contact tracing. We've done an extensive amount of contact tracing here at Regency Oaks to figure out the status of the infection and the outbreak that's occurring here. We've got some data to share with you that I think you will find very insightful. And then the third thing that we're going to do is talk about the booster shot. So let's dig right into it, and we'll go to the screen. All right, this is the Florida Department of Health, the numbers for the week ending August 12th. And so it was published last Friday on the 13th. They are only publishing the summary data on a weekly basis, so we won't have the next updated summary until this Friday. But this is what we've been tracking and looking at on a week-over-week basis. So I think this is still probably the best report for us to go and dig into the numbers with. So the total case count from the prior week was 151,000. If we go down to the bar graph at the bottom of the screen, we can pretty clearly see, starting in the 1st of July and going up through 8/6, there's been a steady increase, and at times it's been almost doubling week over week. So the number of new cases is continuing to rise. We are not seeing a slowdown. In the last 7-day period, it jumped from 134 to 151. So that's about a 17,000 increase. So pretty significant continuation of the virus spread. The positivity rate was 19.3. That's the highest we have seen. The last time we looked at this, it was 18.1. So it went up nearly a full percentage point in a 7-day period. Cumulatively, that's just looking at it over time, and it's here in the state of Florida, it's about 19.1%. We also know that that rate is actually much higher. The experts are telling us it may be as high as 23 or 24% by the time you add in the rapid test or any testing that does not require laboratory results. So continue to watch these numbers, but it does not appear to be getting any better outside of Regency Oaks. One thing that is sort of interesting, if we look at the vaccination rates, they are significantly improved over the last few weeks as this virus, the Delta variant, has started to spread. We are beginning to see people who were not vaccinated get out there and start to be vaccinated. Last week, we administered 384,000 people are completely vaccinated, and that is broken down into first dose and series. And so last 7 days, we had 261,000 people go out and get that very first shot and start the vaccination process. So that's an improvement over what we've seen over the last 4 or 5 weeks. When you look at the age group, we've always seen in the 65 plus a really high number. It's 86% of the state of Florida above the age of 65 are vaccinated. But where we're seeing the significant improvement is in those younger age groups who are finally getting the message and we're beginning to see them go out and start the vaccination process. It's the largest percentage of increase is in that 12 to 19 age group, where we now have nearly 44% of individuals aged 12 to 19 who are vaccinated in the state of Florida. Okay, so this is a chart that reviews contact tracing for all the active COVID cases and quarantined individuals at Regency Oaks. These are all residents. Currently, the staff here at Regency Oaks, there's not an outbreak amongst the staff. We have one or two people who are out, but they are not able to be connected. And so what contact tracing is once you are quarantined or diagnosed as being COVID positive, we try to figure out where you have been, who you have seen, what was your exposure date, with the intention of going back and looking for connections and see if we can figure out patterns on how the virus might have spread from one person to the next. And so this is the contact tracing for our current breakout. Now, I've removed all the individual names just to protect people's individual privacy, but here is what we'd like to look at. We're going to start with the blue circle right down there on the right-hand side. That was the Bill Clark Memorial. We had 12 residents who either tested positive or are in quarantine, and the difference being some of those might be spouses of a positive resident who did not test positive themselves, but they still had to go under quarantine. So not all these numbers are positive COVID. They also include the quarantine numbers. But at the Clark Memorial, which was a Saturday on 8/7, we had 12 residents who were either positive or placed on quarantine because of an exposure. Now, I have spoken to the Clark family, and I can tell you that they also have had individuals who are symptomatic or have tested positive. So we are pretty confident that this is the source of the spread. It may not have been the original source. It's very difficult to determine whether someone brought it into this or did it get spread from another point, but we are able to find that those 12 residents who attended the memorial, 12 of the almost 40 residents who attended had tested positive. We have tested all of the individuals who attended that party, and we feel pretty confident. They all were negative except for these 12, and we feel pretty confident that we have contained that spread, and that if you attended that party, you are beyond the stage of being contagious. And we'll talk a little bit more about that in a minute. From that, you see other colored boxes up there. The military dinner was on 8/6. We had 3 residents test positive and or be placed on quarantine. At the Rays game, there were 2 residents that tested positive. And then at the Scotch Club on 8/9, there were 5 residents that either tested positive or were put in quarantine. And so when we talk about a spreader event, this is the way we track that. And so you see the white circle in the center with the number 5. That means that there were 5 residents who attended the Clark Memorial and also attended at least one other of the other 3 events. And on one instance, we had someone who attended all 3 of the other events. And so that's considered a spreader event, and that is how this is spread. It's person to person, one event to the next. And so you know that our strategy is to contain, to shut it off, eliminate the spread, and wait for that process to stop it based on the lack of mobility and isolation. And so I think we are in pretty good shape, and that we are approaching the end of that. And here's why I say that. If you go back and look at the Clark Memorial, that was on 8/7. We know that after an exposure, it's about 10 days from exposure until the time that you are no longer contagious. So if we take 8/7 and we add 10 days starting on 8/8, that means that on 8/18, those people who might have been exposed on the Clark Memorial, if they haven't tested positive and they are asymptomatic, meaning they're showing no signs of an exposure, they are not likely to contact or contract COVID from that exposure. So anyone who didn't test positive and is not feeling symptoms, you're probably safe at this point. And so we use that same process. The last of these events was the Scotch Club on 8/9. There were 5 people exposed there, tested positive or are quarantined. We add a day, start the clock on 8/10, which means on 8/20, which is tomorrow, if you haven't tested positive or don't have symptoms, you very likely are not going to contract COVID from that exposure. So what that means is that we are at the end of the timeline where this particular outbreak can infect others and continue to spread. And so just what you would expect to see is what we are in fact experiencing. For the first few days of this calendar week, we've had 3 or 4 new exposures on a daily basis. Today, our first day without a single exposure. So in the last 24 hours, we've not had anyone report new symptoms or test positive for the virus. That's exactly what we would expect to see. We were able to isolate the population, stop the mobility, contain the disease, and 10 days later, these numbers should start to come down, and in fact, it appears that that is the case. So, speculating a little bit further, that means that on 8/20, which is tomorrow, we should be clear of this. I need to go at least 5 days with no new infections. So walk through that with me. That would be Friday, Saturday, Sunday, Monday, and Tuesday. So if we can get through next Tuesday without a new exposure, we will conclude reasonably that this exposure from this particular outbreak has been contained, and we'll be able to start looking at reopening. Now, there's 2 other things that I want to talk about on this chart. There are 4 additional residents that have either tested positive or have been quarantined that had that were positive but did not attend one of these 4 events. However, our contact tracing shows that each and every one of them had dinner with one of the 5 super spreaders. And so we can directly link their exposure back to a super spreader who attended at least 2 of the 4 events. And so what we can conclude from that is if you did not attend one of these events, no one is testing positive if they did not attend one of these events. So we had 40 some odd folks attend the initial event, and you can see that 12 of them tested positive. You can count these numbers Real quickly, it's 27 plus 3 more. So it's 29 people who either tested positive or are under quarantine. And we feel like we have reached the point where we probably have a handle on this. So just once again to recap, we'll continue to monitor this. We expect that these numbers will continue to decline. We are looking starting tomorrow for 5 consecutive days without a new case that we can tie back to this breakout. And then at that point, next Tuesday, we will be able to come back together and evaluate whether it's safe to reopen. So I can safely share with residents that I think this thing has been contained, and we will continue to update you if there are significant changes. So right now, I don't anticipate being back here tomorrow, but I think for through the weekend, we probably will continue to see improvement in numbers. Okay, let's talk a little bit about the booster. I know this is generating a lot of conversation. So you probably saw that President Biden yesterday talked about being able to have every American receive a booster. I think that's a great idea. I support that, and it's something that we're going to work to facilitate here at Regency Oaks. Currently, right now, the only one who is eligible for a booster is someone who has an autoimmune deficiency or a physician's order for the booster. They are available. You can go to any of the local pharmacies and get that booster shot. We anticipate that with the President's announcement yesterday that CDC very quickly, within the next 3 to 4 days, will issue executive orders implementing how this is going to be carried out across the United States. We've had an initial conversation with CVS, our joint venture partner from the original COVID clinics, and here's what they're suspecting is going to happen. Once they have the published guidelines, again, that should happen Monday, Tuesday of next week, they will go back and they will categorize all the 1A and A clinics that were held in December and January, February of last year. So we have a clinic number. If you look on the back of your vaccination card, there's a clinic number. CVS will pull those clinic numbers, put them into the order in which they were administered, and then prioritize them based upon who is closest to the 8-month time frame between the second shot and the booster. And so that means that most of us here at Regency Oaks will be eligible for that booster sometime in mid-September through mid-October. So at this point, I just want you to know that we're already in contact with CVS. The plan is to hold additional clinics here at the community. And as soon as we have detailed information from CVS, we'll be back in touch with you. But I anticipate that those clinics will probably be mid-September, early October. If you have a sense that you need to get this vaccine earlier, it is available if you have a physician's script or you have an autoimmune disorder that will qualify you to receive it earlier. So the boosters are going to happen, and we're going to try to make sure that we coordinate it and offer it here at Regency Oaks. Two other things that I will mention is if you are not vaccinated and decide that you want to be vaccinated, we are able to administer the Moderna vaccine right here on campus. And so if that's something that you haven't done and now have decided you're interested in doing, we're happy to set that up. All you have to do is get a hold of Leslie, and she will schedule an appointment, and we can do that without you having to leave campus. You can do it right here. The one other follow-up that I'm getting a lot of questions on is, well, what about the flu clinics that are scheduled? The flu clinics are really important. They are on track. We will continue with those clinics. It's very important that every resident at Regency Oaks gets a flu shot, whether you get it from us, your physician, or a participating pharmacy. Just be sure to let the front desk know where you got that flu shot and that you got it. It is not time sensitive in terms of the vaccine. You can get the flu shot and the booster at the same time or a week apart. There's no requirement for any separation between those two separate injections. So that covers all the topics that I wanted to address today. I hope I've given you some good information. I'm feeling pretty confident looking at the contact tracing and the fact that if you didn't attend one of those parties, you haven't gotten infected. We've done a great job, residents, of shutting down the community, of isolating, of limiting our mobility. I cannot tell you how appreciative I am of your support and the great job you're doing of wearing a mask, practicing good social distancing, and being a part of a larger family. So we're headed in the right direction. There's light at the end of the tunnel. I don't think I'll need to be back again tomorrow, but we're on standby. If something changes, I'll get back in touch with everyone through 7:32. If not, I'll be back Monday morning with an update, and everybody have a great weekend. There's light at the end of the tunnel, and it's not a train. Thanks.